feel are some of the biggest problems for rural Nevadans as far as health care in this area?
I think it's a double whammy. One, we don't have enough access to health care. And then two, people don't have insurance. Or if you are on Medicaid or Medicare, we have, there's not a lot of providers that take those two things. I hear the stories all around me, my friends, and it's scary for them. They make choices like if they take the kids to the dentist this month, then they don't get shoes, or they really have to cut back on the food budget. So those choices are hard to make, and then some of the families here aren't even able to make those choices. It's between dentistry or medical care and food, and you can't make those choices.
I'm here to get whatever I can free, because without having medical insurance and with the economy, we don't have spare money lying around to do that kind of stuff. Anytime we have any extra anything, it goes directly to our kids, because you know what? We're older, I'm more concerned about, I'm concerned about me getting better, but I'm more concerned about them. They're still young, they still have a full life to live. And a lot of times I put my needs aside, because I had a tooth that was just, and it wasn't until we finally got some tax returns that I was able to finally go in and the dentist was actually really sweet.
Yeah, it was not long ago that Lyon County was one of the largest growing counties in the country. And when the bottom fell out on the economy, this county, being the largest growing, became the hardest hit. I think we were third in the nation at one point with foreclosures, job abandonment. There's basically a lack of jobs. Our unemployment rate's 18%. And all these financial pressures on the family affect our children.
It's kind of difficult not having insurance and stuff. It's hard to even find one to afford on minimum wage anymore. So it's kind of hard to do really anything without any insurance, because you got to save all your money just to get stuff done. But I had to actually sell my car to actually pay some bills and stuff. Yeah, it can get pretty difficult.
You may have a small injury, a small sickness, and unfortunately you don't have the insurance to get it taken care of or even prevented at the beginning of your illness or injury, and it exacerbates to a point where it becomes a major medical issue.
There are health issues that both me and my husband have had that we can't afford to pay out of pocket. I've been diagnosed with high blood pressure, and I probably should get diabetes care and everything, but I can't afford it.
Even with insurance, it's a struggle. I'm a single mom with 2 kids, and I really have to weigh my choices carefully. So I understand the stress and strain of trying to get appropriate, good, reliable health care.
It surprised me that there was a chiropractor here, and so I signed up to look at the chiropractor. I hurt my back a couple weeks ago, and I didn't even know for sure there was something wrong because I couldn't afford to go. My family has to do what I couldn't do, which was most of everything. And so it was a hardship for them. Didn't just affect me. If you can't go to the doctor, there's no options. You just hurt. There's no way around that. And people hurt and they try to get by, and you can't get by when you're hurting. It's just hard on everybody.
It does put a strain on the family. It puts a strain on the individual, and it's hard to focus on the other aspects of life when you're under a strain like that.
I had insurance when my son got ill. At the end of that, I ended up owing over $7,000 in stuff the insurance company didn't cover at all. But it was harsh, and I was fully insured.
I had one surgery where I was in the hospital 2 months, and it was over $800,000, and it bankrupted me. I had to sell everything, mortgage everything, and then that's when I told him, I said, hey, I've got to get some help.
If you have insurance, you can always find somebody to care for you. What if you don't? Where do you go? It's hard to find that in a rural area.
We've seen some people here today on Medicaid, Medicare that can't get in to see anybody, and that's really frustrating. It's heartbreaking.
It's been pretty rough. Mainly because I had to mortgage everything, sell everything, because we were pretty well fixed till that happened, and medical just eat me up.
Just walk a few months in my shoes. I have 4 kids that I love to death. Wow. Sorry. They're my pride and joy. And not being able to have this stuff for them, it's hard. Come over to the dark side of what it is to not have insurance and see what we go through.
A solution would be events like this. I mean, if more community leaders would facilitate this type of activity. I mean, if you look around, you have the Lions Club, you have a student from Dayton High School providing entertainment, and you have medical professionals donating their time to not only treat individuals that need treatment, but educate them. And once we educate the individuals on how they can deal with a broken system, then we can help people.